Adenovirus is an extremely contagious virus that can cause symptoms such as fever, sore throat, cough, runny nose, nausea, diarrhea, and a rash. Although adenoviruses are usually mild in children, there have been instances where they have caused death. The common cold is an example of an adenovirus infection. We will go over 20 scary facts about the adenovirus infection. Number 20. Adenovirus infection is not new. Adenoviruses were first identified in 1953 when scientists were looking for viruses that could cause respiratory illness in humans. They found 4 types of adenoviruses in the adenoids of children who had been tonsillectomized. Since then, more than 50 different types of adenoviruses have been identified. Number 19. Adenovirus can be transmitted through various routes. Adenovirus is a very contagious virus and can be transmitted in several ways. It can be transmitted through contact with an infected person, usually through respiratory droplets from coughing or sneezing. It can also be transmitted through contact with contaminated surfaces or objects. And finally, it can be transmitted through airborne particles that can remain suspended in the air for long periods of time. Adenovirus is most contagious during the first week of infection, but can remain contagious for up to 2 weeks. Number 18. There are more than 50 types of adenoviruses. As of 2021, there are more than 50 different types of adenoviruses that have been identified. These viruses are divided into 7 different species based on their genetic makeup. Species A, B, and C cause disease in humans, while the other species infect other animals. Within each species, the viruses are numbered in order of discovery. For example, the first adenovirus isolated was type 1, and the second was type 2. Number 17. Some adenoviruses can cause cancer. While most adenoviruses cause only mild respiratory symptoms, some types have been linked to cancer. Adenovirus type 12, for example, has been found to cause both liver and kidney cancer in experimental animals. In humans, adenoviruses have been found to cause a rare type of cancer called epithelial inclusion conjunctivitis, which affects the eye. Number 16. Adenovirus infection is more common in children. Adenoviruses are very common in children and most infections are mild. However, some types of adenoviruses can cause severe illness in children, such as pneumonia and encephalitis. In addition, adenovirus infection is a leading cause of acute respiratory distress syndrome, ARDS, in children. This is a serious condition that can cause the lungs to become filled with fluid and prevent them from working properly. Number 15. Adenovirus infection can lead to pneumonia. Pneumonia is an infection that causes inflammation of the air sacs in one or both lungs. The air sacs may fill with fluid or blood, causing symptoms such as a cough, fever, chills, and difficulty breathing. Adenovirus is a common cause of viral pneumonia, especially in young children and military recruits. Number 14. Adenovirus infection can cause acute respiratory distress syndrome. Acute respiratory distress syndrome, or ARDS, is a serious lung condition that can occur in people with adenovirus infection. ARDS is characterized by widespread inflammation of the alveoli, the tiny air sacs in the lungs. This inflammation causes fluid to accumulate in the alveoli, making it difficult to breathe. People with ARDS often have trouble getting enough oxygen into their bloodstream, which can lead to other complications, such as low blood pressure and organ failure. Treatment of ARDS typically involves providing supplemental oxygen and mechanical ventilation. Number 13. Adenovirus infection is associated with epidemic keratoconjunctivitis. Epidemic keratoconjunctivitis, or AK, is a highly contagious eye infection that can cause severe pain and even blindness. Adenovirus is the most common cause of epidemic keratoconjunctivitis, which is spread through contact with an infected person or contaminated surfaces. Symptoms of the condition include a burning sensation in the eyes, blurred vision, redness, and discharge. Treatment options include antiviral medications and lubricating eye drops. Number 12. Adenovirus infection can lead to gastroenteritis. Gastroenteritis is an inflammation of the stomach and intestines that can cause vomiting and diarrhea. Adenovirus is a common cause of viral gastroenteritis, especially in young children. Symptoms of adenovirus gastroenteritis typically begin abruptly and may last for 1 to 2 weeks. Treatment of adenovirus gastroenteritis includes rehydration and monitoring for signs of dehydration. Number 11. Adenovirus infection can cause cystitis. Cystitis is an infection of the bladder that causes pain when urinating, frequent urination and a burning sensation. Adenovirus is a rare cause of viral cystitis, but it can occur in people with weakened immune systems. Treatment of adenovirus cystitis includes pain relievers and antibiotics. Number 10. Adenovirus infection can cause hepatitis. Hepatitis is an inflammation of the liver that can cause jaundice, abdominal pain, and dark urine. Adenovirus is a rare cause of viral hepatitis, but it can occur in people with weakened immune systems. Treatment of adenovirus hepatitis includes rest and monitoring for signs of liver failure. Number 9. Adenovirus infection can cause myocarditis. Myocarditis is an inflammation of the heart muscle that can cause chest pain, shortness of breath, and irregular heartbeat. Adenovirus is a rare cause of viral myocarditis, but it can occur in people with weakened immune systems. Treatment of adenovirus myocarditis includes bed rest, medications to control heart rhythm, and monitoring for signs of heart failure. Number 8. Adenovirus infection can cause encephalitis. Encephalitis is an inflammation of the brain that can cause a fever, headache, confusion, and seizures. Adenovirus is a rare cause of viral encephalitis, but it can occur in people with weakened immune systems. Treatment of adenovirus encephalitis includes bed rest, anti-seizure medications, and monitoring for signs of brain damage. Number 7. Adenovirus infection is associated with hemorrhagic cystitis. Hemorrhagic cystitis is a rare but serious condition that causes bleeding from the bladder. Adenovirus is one of several viruses that has been associated with hemorrhagic cystitis. Symptoms of the condition include pain when urinating, frequent urination, and blood in the urine. Treatment of hemorrhagic cystitis includes pain relievers and in some cases surgery to remove part or all of the bladder. Number 6. Adenovirus infection can lead to hemolytic uremic syndrome. Hemolytic uremic syndrome is a rare but serious condition that causes the red blood cells to break down at a faster than normal rate. This can lead to anemia, kidney failure, and neurological problems. Adenovirus is one of several viruses that has been associated with hemolytic uremic syndrome. Treatment of the condition is supportive care, such as blood transfusions and dialysis. Number 5. Adenovirus infection is a leading cause of acute respiratory infections in military recruits. Military recruits are at increased risk for adenovirus infection because they live in close quarters with other people. This makes it easy for the virus to spread from person to person through respiratory droplets. Adenovirus infection in military recruits can cause severe illness, including pneumonia and acute respiratory distress syndrome. Number 4. Adenovirus infection is the most common cause of acute respiratory tract infections in US Marines during training. Adenoviruses are a group of viruses that cause respiratory illnesses such as the common cold and pneumonia. They are highly contagious and can spread easily through respiratory droplets or contact with contaminated surfaces. Marines are particularly susceptible to adenovirus infection during training because they live and work in close quarters with other recruits. This close contact allows the virus to spread quickly through the population. Additionally, the stress of training may weaken the immune system, making it easier for recruits to become sick. Number 3. Adenovirus infection is responsible for a significant number of deaths in US military personnel. Adenovirus is a common virus that causes respiratory illnesses such as the common cold and pneumonia. It can be spread through respiratory droplets or contact with contaminated surfaces. Although adenovirus is usually mild in healthy individuals, it can be dangerous for those with weakened immune systems. From 1998 to 2000, adenovirus was responsible for 170 deaths in US military personnel. Most of these deaths occurred in recruits during basic training. This is thought to be due to the combination of close living quarters and a weakened immune system. Number 2. Some adenoviruses are currently being used as cancer therapies. Gene therapy is a type of treatment that uses genes to treat or prevent diseases. In recent years, some adenoviruses have been modified and used as vectors to deliver genes to cancer cells. By doing so, researchers have been able to target and destroy cancer cells while leaving healthy cells unharmed. One of the most promising uses of adenovirus as a cancer therapy is in the treatment of lung cancer. Adenovirus has been shown to selectively infect and kill lung cancer cells, with minimal side effects to healthy lung tissue. Another area of research is the use of adenovirus to treat cancers of the eye, such as retinoblastoma and uveal melanoma. Clinical trials are currently underway to determine the safety and efficacy of this approach. Adenovirus-based gene therapy holds great promise for the future of cancer treatment. Number 1, vaccines against adenovirus infection are available. Several vaccines against adenovirus infection are currently available, but they are not routinely recommended for the general public. Vaccines are available for people who are at high risk of infection or who have a weakened immune system. These include people who work in healthcare, military personnel, and people who are undergoing chemotherapy. Thank you for watching. Do you find this video informative or helpful? Let us know in the comments section below. Make sure to subscribe so you don't miss out on future videos. Don't forget to like and share. Stay healthy.